Hi everyone. In today's clip, I will talk a little bit about lichen sclerosis. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. Lichen sclerosis, or LS, is a chronic inflammatory skin condition that most often affects the genital and anal areas, though it can occasionally appear on the chest, shoulders, thighs, or wrists. The skin becomes thin, pale, or white, fragile, shiny, and sometimes scarred, almost like a delicate sort of parchment paper. It can affect women, men, and children, although it is most common in postmenopausal women. Other names for this ailment include balanitis xerotica obliterans, or BXO, in males, and white spot disease. Common symptoms vary from amber glow, irritation, to severe architectural changes. And typical signs are intense itching, especially at night, burning or soreness, white shiny patches, skin tearing or fissures, pain during intercourse, painful urination or bowel movement, easy bruising or bleeding, tightening or scarring of the tissue, and fusion of genital structure in severe cases. Just to repeat the last part because my puppy was barking: easy bruising or bleeding, tightening or scarring of the tissue, and fusion of genital structures in severe cases. And in men, the symptoms are a bit different, and they include tight foreskin, painful erections, and narrowed urinary opening. This ailment, if left untreated, can lead to scarring and increased risk of squamous cell carcinoma in affected areas. Squamous cells are a type of thin, flat cells that make up the surface layer of many parts of the body, like skin, mouth, lips, throat, esophagus, lungs, cervix, and other parts of reproductive system. So modern dermatology generally considers lichen sclerosis an autoimmune or immune-mediated ailment associated with chronic inflammation influenced by genetics, hormones, microbiome changes, skin trauma, or chronic irritation. Also, this is sometimes linked with thyroid disease, vitiligo, alopecia areata, and other autoimmune conditions. And of course, this is not contagious and is not considered a sexually transmitted disease or anything. Modern medical treatments include ultra-potent topical corticosteroids, and they consider this the gold standard first-line treatment, applied twice daily initially for several weeks, then tapering to maintenance use, which is often 1 to 3 times a week. And the goal is to stop inflammation, prevent scarring, reduce cancer risk, and to relieve itching and pain. But just like any other chemical treatment, over time, it does have many side effects, from not so serious to extremely serious. The second line of treatment applied are calcineurin inhibitors with when steroids sort of fail or cannot be tolerated, and these basically suppress immune activity. And third line of treatment is, of course, surgery. So for males, circumcision may be curative in some cases when foreskin involvement is severe. And for advanced female issues, surgery may be needed for scar tissue to release. And doctors also recommend petroleum jelly or barrier ointments, gentle washing only, avoiding fragrances and harsh soaps, loose cotton clothing, and avoiding friction. Orthomolecular medicine views lichen sclerosis as a terrain problem involving chronic inflammation, oxidative stress, nutrient deficiency, gut dysbiosis, immune imbalance, hormonal imbalance, and collagen or connective tissue weakness. The nutrients that are suggested are vitamin D3 plus K2, and this is emphasized because autoimmune disease often correlate with low vitamin D. Typical dosages range from 2,000 to 10,000 international units daily, and to ensure to include at least 100 milligrams of K2 per every 1,000 international units of D3 MK7 type for proper absorption. Of course, monitoring blood levels is very important. Another nutrient is zinc, which is important for skin repair, immune regulation, tissue healing, and the dosage range from 15 to 50 milligrams of elemental zinc daily, and long-term higher doses sort of may require copper supplementation. Then there is omega-3 fatty acids, fish oil or cod liver oil, or krill oil, often used for inflammation reduction with doses ranging from 1 to 3 grams EPA or DHA daily. Then we have vitamin A for epithelial repair and mucosal integrity with doses ranging from 5,000 to 25,000 international units daily short term, because excess vitamin A can become toxic. Then we have vitamin E, used internally and topically in doses ranging from 100 to 400 international units a day, and some people apply vitamin E oil locally and topically. Then there's magnesium, often used for immune modulation and nervous system calming, with doses ranging from 200 to 400 milligrams a day. There is selenium, suggested because of autoimmune thyroid overlap, in doses of 100 to 200 micrograms a day, and that's maximum. And then we have pre and probiotics, and I cannot express the importance of these nutrients, as they will address gut permeability, candida imbalance, and microbiome disruption. Common strains that we use for this are lactobacillus as well as bifidobacterium, but larger number of strains, of course, can be helpful. Then there are collagen support nutrients used to support sort of fragile tissue, and they include vitamin C, silica, glycine, bone broth, and collagen peptides. Vitamin C doses usually range from 1,500 to 5,000 milligram daily or more, depending on the person and the condition. Also, people have reported improvements after removing gluten, sugar, processed oils and foods, sweeteners, dairy, and some sort of follow autoimmune paleo or AIP diets, as well as low oxalate and anti-inflammatory diets. It would be a good idea to have a food sensitivity test done to better understand what the person is allergic to begin with, and then also to have sort of like a measuring stick so that you know what you're dealing with. In traditional medicine, we would classify this condition under dry cold tissue disorders, as well as weak tissue nourishment, abnormal black bile balance, and chronic irritation and tissue degeneration. The skin is viewed almost like a soil in a wind-struck sort of garden when nourishment and moisture decline and tissue becomes pale, thin, stiff, and easily cracked. So we would suggest moistening therapies, and the goal is to counter excessive dryness and tissue fragility with oils like violet oil, sweet almond oil, rose oil, pumpkin seed oil, and olive oil. And please note that these are not essential oils. Also, these are often gently applied topically. Next comes the blood and liver support, in which the impure blood or liver dysfunction is linked to chronic skin diseases. Now, the herbs that are used for this are burdock, chicory, yellow dock, mallow, marshmallow root, I should say, and fumaria. As I'm naming all of these, I want you to all know that you definitely would need to consult a holistic doctor to ensure that the amounts taken are appropriate, as well as they should understand your specific body needs. This is not a one formula fits all. What may help one person may not agree with another, and need to be carefully orchestrated to ensure that you get the most out of your treatment. Also, keep in mind that holistic doctors will not give you a prescription and say, see you later, but they need to continually keep in touch, see the results, and alter the dosages based on what they see externally and through tests. So be patient, as this kind of process may take a few trips, but the results are long-lasting and much healthier, of course. Next, there would be some cooling anti-inflammatory herbs suggested and involved, such as rose, purslane, violet, plantain, chamomile, and these are often used as washes or compresses. Then, of course, we have the dietary changes to reduce foods that are considered drying and irritating, such as excess salt, vinegar, preserved meats, alcohol, excess spices, while the moistening foods sort of are encouraged, such as barley soup or barley water, lamb broth, cucumbers, pomegranates, almonds, and ghee oil in moderation. Then there is sun and sorrel plants for pigments and skin disorders, such as celery seed, parsley, and fig leaves. But genital application with sun exposure can burn severely and should not be done. Because LS can increase cancer risk and permanently sort of scars the tissue, please remember that a proper diagnosis definitely matters. And biopsy is sometimes needed, and regular follow-up is very important. And of course, early treatment prevents anatomical damage. Some people initially mistake LS for yeast infections or vitiligo or eczema or lichen planus or psoriasis or fungal infections. Remember, rather than seeing this as only skin disease, we need to view it as a whole body inflammatory terrain issue with local manifestations. A fragile parchment can still be preserved if the fire underneath is calmed and the wind above is sort of softened. Hope this has been helpful. My clips are available on TikTok and YouTube. Like, share, and follow for more. Be the light.